At L1 spinal cord tapers into conus medullaris. Where are the enlargements in the spinal cord and what do they represent? Cervical C7-8 and lumbosacral L4-L5 to enlargements where cervical, lumbosacral plexuses arise to supply limbs, reflects greater motor and sensory activity. What is the end of the spinal cord at birth? L3. What is the end of the spinal cord in adulthood? L1, L2. Lumbar, sacral roots below the end of spinal cord continuous. Cauda equina. What does the termination of the spinal cord allow? Access of CSF via lumbar puncture at L4 per liters 5. What happens to the length of spinal roots progressively down the spinal cord? Increase due to disparity between the length of cord and vertebral column. Describe layers of meninges from out to in. Dura mater, arachnoid mater, pia mater. What is dura mater? Where does it start, finish? Outer tough fibrous layer extending from head to S2. What does extradural space contain? Fat and internal vertebral venous plexus draining red bone marrow of vertebral bodies via basovertebral veins and links up with cerebral, pelvic veins. No valves.
Where is subarachnoid space and where does it finish? Between arachnoid mater and pia mater, ending at S2. What does arachnoid space contain? CSF.
What does arachnoid mater line? Dura mater. What does pia mater extend inferiorly as? Filum terminale which pierces dural sac to attach to the coccyx. What does pia mater do? Thickened on each side between nerve roots to form denticulate ligament which passes laterally to adhere to the dura. What arteries supply blood to the spinal cord? Anterior and posterolateral spinal arteries. Where does blood supply to spinal cord arise from? Intracranial part of vertebral artery. What layer is spinal blood supply found? Subarachnoid space. What reinforces spinal cord blood supply? Artery of Adamkiewicz to lumbosacral part of the cord. Segmental spinal branches along with roots. What is the central canal filled with? CSF. In what region do preganglionic sympathetic neurons arise from the spinal cord and from where? Lateral horn. T1L2. Describe where parasympathetic preganglionic fibers arise from. S2S4, cell bodies in lateral horn. Where do spinal nerves arise from relative to corresponding vertebrae? C1, C7 arise above their vertebra. C8 emerges below C7 and subsequent nerves emerge below corresponding vertebrae. Describe the size of descending and ascending tracts going from caudal to rostral in the spinal cord. Ascending tract increase in size. Descending tract decreases in size. How can you distinguish thoracic spinal cord? Prominent lateral horn. Describe how the proportion of gray, white matter changes along the length of spinal cord. The proportion of gray matter decreases as you go up the spinal cord. In what regions is gray matter largest in the spinal cord? Cervical and lumbar enlargements. Describe the organization of the ventral horn. Compromises motor pools, in which all motor neurons innervate the same muscle. Motor columns formed from motor pools innervating muscles of similar embryonic origin. Describe the medial and lateral motor columns of the ventral horn. Medial motor column, motor neurons innervating axial muscles of back and body wall to posture and balance. Lateral motor column 2, found in the lumbar and cervical spinal cord, motor neurons innervating limb muscles. Describe how ventral horn is arranged distally proximally and ventrally, dorsally. Proximal to distal equals trunks to hand. Ventral to dorsal to extensor to flexor. What happens to large diameter axons or alpha and a beta as they enter the dorsal horn? Enter medially and possess ascending collaterals. What happens to fine diameter axons as they enter dorsal horn, e.g. A delta and C. Enter laterally and project across several segments in Lissauer's tract. What does the laminar organization of gray matter represent? Different functions of neurons. What lamina do alpha and a beta innervate, influence? A alpha to 6, 7. A beta to 3 to 6. What is lamina 1? Give an example of what terminates here. Posteromarginal zone, including larger projection neurons that project via contralateral side to the thalamus, nociceptive specific info. E.g., a delta terminate here to localization of pain. What is lamina 2? Given an example of what terminates here. Substantia gelatinosa, interneuron, e.g. C fibers synapse onto interneurons, which synapse onto neurons in nucleus proprius. More synapses equals more modulation. What is lamina 4/5? Give an example. Lamina proprius to main sensory nucleus to different inputs, e.g. nociceptive, somatosensory converge onto projection neurons that project contralaterally to poor localization and mixed modality to wide dynamic range neuron. Describe the relevance of lateral horn in proprioceptive afferents. From leg the ascend to thoracic level and form axon collateral synapsing onto neurons in Clark's column in the lateral horn. What is Clark's column? The thoracic nucleus in lateral horn to relay to ipsilateral cerebellum via spinocerebellar tract. What does lateral horn contain? Preganglionic autonomic neurons SYMPT1L2 and para-S2S4. Name 5 descending tracts. Corticospinal, vestibulospinal, reticulospinal, rubrospinal, tectospinal. Name 3 ascending tracts. Dorsal, ventral spinocerebellar tract. Anterolateral columns. Dorsal columns. What is CST4? Major descending control pathway from cortex for voluntary movement. Describe the course of most fibers in CST, 90%. Originate from the primary motor cortex, and supplementary motor area, premotor cortex, sensory areas decussate in the medulla and descend on the contralateral side of the spinal cord in crossed lateral CST. What happens to 10% of CST fibers? Do not decussate and descend on the ipsilateral side of the spinal cord as uncrossed ventral CST, i.e. anterior and lateral uncrossed CST, and fibers synapse with ventral horn neurons on the opposite side at each segment. What happens at each spinal segment to CST? Fibers enter the intermediate zone to innervate interneurons and ventral horn to innervate motor neurons. Describe where vestibulospinal tract arises from. What does it do? Lateral and medial vestibular nucleus to upright posture, balance, facilitates extensor and inhibit axial motor neurons, conscious realization of spatial orientation. What does the reticulospinal tract arise from and do? Brainstem reticular formation to maintaining tone, balance and posture especially during body movements. What does the rubrospinal tract arise from and do? Red nucleus to voluntary movement especially flexion of distal arm muscles. What does the tectospinal tract arise from and do? Tectum, superior colliculus to reflex postural movements in response to visual, auditory stimulus. What does dorsal, ventral spinocerebellar tracts do? Relay Clark's columns neurons proprioception from lower limb to ipsilateral cerebellum through inferior and superior cerebellar peduncles respectively. What does dorsal column comprise? Medial fasciculus gratulus, legs, and lateral fasciculus cuneatus, arms, to transmit ascending branches conveying touch, vibration, proprioception on the ipsilateral side of the cord to dorsal column nuclei in the medulla. Where does fasciculus cuneatus arise from? T6.